everyone, welcome to Self-Support Going to A&E. I'm Megan at the Pituitary Foundation. For those of you not familiar with the foundation, we provide support for the 70,000 and more people in the UK who are affected by disorders of the pituitary gland, as well as their families, friends and carers. We want to ensure that every person affected by a pituitary condition has a timely diagnosis and access to high quality treatment, information and support. We have a dedicated nurse helpline, online and printable resources, and we work with the leading medical experts to improve patient care. I'm really excited to be having this talk as part of our Pituitary Awareness Month 2022 Living Well programme, and to be joined by our own endocrine nurse, Pauline Whittingham, and Cathryn James from the Association of Ambulance Chief Executives. So over to you, Cathryn.
Thank you, Megan. I'll just bring up my slides. Okay, so I'm going to talk about ambulance services, and obviously if you needed to ring an ambulance and if you needed to get help for your condition, I'm just going to go through all the ins and outs of what's best to do and what to expect. So I'm Clinical Support Manager for the Association of Ambulance Chief Executives, and I'm a paramedic. I've worked in ambulance services for 41 years and been a paramedic since 1987. So in England, there are 10 English ambulance services, and then there's Scotland and Northern Ireland as well, and Wales, of course. Our association is a membership organisation, and it provides ambulance services with a central organisation that supports and coordinates and implements nationally agreed policy. So, calling for help. I think it's about deciding what help you need. And the two main systems out there that are 24/7 is obviously the 999 and also the 111. The 999 number is for life-threatening problems where someone is seriously ill or injured and someone's life is immediately at risk. And try and think about, do you really need the blue lights and sirens for your condition? If not, then think about using 111. You can ring the 111 number, or you can now use 111 online. So this is for urgent care problems where you're not sure what to do, or where you might need some general health information or advice. Obviously, of course, there's your own GP, or you may have an endocrine nurse that you can contact. And they're available, obviously, within the hours of normally 9 to 5-ish. And 111 can also be used in out-of-hours situations for such things as emergency prescriptions if you run out of medication. Or if hopefully you don't do this, but if you forgot your medication for holidays, etc. So think carefully about what help you need. If you did contact 111 and they deemed that your problem was life-threatening, they can immediately put your call through to 999. So, you can choose obviously which one to use, but please choose carefully. So if you do ring 999, the first thing you're asked is to confirm the address of the emergency. And this is so we can get the ambulance on its way. So you still might be asked quite a lot of questions and you feel like, oh, is the ambulance coming? But actually, the ambulances are often dispatched, especially to the life-threatening emergencies, as soon as the address is confirmed. And an early question that we now ask is, are you conscious and breathing? And this immediately helps us to prioritise the degree of how life-threatening your call is. What's really, really important, perhaps the most important message I'm going to give you today is that if you ring 999, you may be ringing for lots of different reasons, and you may have a range of symptoms such as vomiting, diarrhea, dizzy, etc. But it's really important to say on the call that you suspect you're in adrenal crisis and use those words, or use the words steroid dependent. Please stress that you're a steroid dependent patient, or that you have Addison's disease or crisis or adrenal insufficiency. So if you use one or a combination of all those words when you ring in 999, that helps us to prioritise the call to make sure we get you the right help. The ambulance care and treatment that you may receive is based on some national ambulance guidelines, and we have a specific guideline for steroid-dependent patients. We didn't used to do, it's fairly recent, but we felt it really needed some emphasis for the range of patients that may be steroid dependent, just to give a focus for our paramedics and ambulance clinicians to consider patients may need steroids, because hydrocortisone is carried on all frontline ambulances. Although we know all patients with diagnosed adrenal insufficiency and Addison's disease that are on steroid replacement therapy should also carry their own emergency injection kit. Our staff are trained to give it, but don't hesitate to remind the staff that you may need it. And the steroid alert card is also within our guidance so that our paramedics are familiar with what it looks like. So you as your patient know your condition best. As paramedics, and as I said, I've been a paramedic for many years, we come across all sorts of patients in all sorts of situations and all sorts of conditions, but we don't know everything. We're well trained in life-threatening emergencies, but we need to, it's best if a patient says to us, this is my condition and I need to tell you this about my condition. So don't be afraid of repeating to various health professionals if you go into hospital that you're steroid dependent, that you may have adrenal crisis, just so the message is continued. And show staff your steroid dependent card or medical alert. That's a visual reminder that you're steroid dependent. There's been a lot of discussions about flagging or putting a little flag on someone's address so the ambulance crew know you as a patient, but there are real difficulties with that and we do not recommend it. And that's because of the complex systems that we work in and the simple fact that if you flag an address and then someone moves house or there's other people living at the address, or when you become ill, you might not actually be at that address, you might be out and about. It's not the best way of alerting the ambulance service. So the other ways of what I've just said are just telling everyone, every healthcare professional that you are steroid dependent. So access to health records is improving. You may be asked at some point for consent for us to access your health record, but actually a lot of patients that we arrive, blue lights and sirens arriving at a house, we may not know about your health record or your health condition. So please tell us, just to belt and braces the fact that we know all about your condition. And if you go into hospital, we recommend that you take all your medicines with you. That's standard for any patient. And what can you do as patients? Know your sick day rules and when to use them. Have a contact number for your endocrine nurse specialist. Wear or have with you your medical alert bracelet or necklace if you have one. Make sure you have enough medication so you don't get stuck. Carry your emergency kit and check its expiry date. And make sure you know how to administer it, or that a friend or relative or teacher, etc., is also trained to give it. It might be rarely given or never used, but hopefully not, but it's worth refreshing yourselves and your families to make sure you're familiar with it. And then if you think you do need to go to hospital, an ambulance at the end of the day might not be as quick and appropriate. It may be okay to actually get in your car, get someone to drive you to A&E if safe to do so. As you know, the NHS is really busy at the moment. Everything seems rather stretched. We do get thousands of 999 calls a day, and we have to categorise which patients need the ambulance first, and this does lead to delays. And I think you'll have seen in the media, there are currently a lot of delays on handing over patients to hospital with the ambulances queuing outside. If a number of ambulances are queuing outside the hospital, this unfortunately leads to increased response times for those waiting in the community, because we've only got a finite number of ambulances. So just, again, think carefully about using 999. Think about whether you could make your own way to hospital. But don't be scared of using us. We are here 24/7 if you need us. If you need to provide any compliments or comments or complain about our service, then feedback and praise is good. We do like that, obviously. Tell us what you think, because we are learning organisations and we want to learn from patient experiences. Learning from mistakes is vital to how we improve our services. And there's also the friends and family test where you can comment as well. And each ambulance service has got a website with information on simple ways of how you can compliment, comment or complain about us. So thank you for listening. That's it. My email's at the bottom there. Thank you very much.
Thank you, Cathryn. That was brilliant. so useful, even for someone such as myself who isn't a pituitary patient. It's just all really good to know. Pauline, did you have any questions?
Yeah, well, just a bit of clarity. I'm thinking about the when we ring 999 and we state adrenal crisis, steroid dependent. If a patient felt it wasn't exactly life-threatening, but they wanted some advice, would it be appropriate for them to ring NHS 111 and use the same terminology and then get the advice from the clinician on the line there?
Yeah. Yes, Pauline, good question. Again, just think carefully. If you think you're life-threatening, don't hesitate to ring 999. But use 111 if you're not sure what to do. If you're not sure whether you need to go to hospital or not, and you need to discuss some concerns about your symptoms. Yes, absolutely. Stress to 111 that you're at steroid dependent, adrenal patient, potentially an adrenal crisis. And you will get asked a range of questions, whether you do it through the 111 online route or whether you ring up and phone 111, but you will get to the right place. And if they deem that you need an ambulance, they will put you straight through to the 99 ambulance. If not, they will direct you to the right care or give you the right advice.
Excellent. So that's good to know that whichever route into 111, there's ability there to say steroid dependent, a potential adrenal crisis, I need some help, and they've got skilled people that are able to direct in a safe way without putting that extra burden onto the 999 system.
Yeah,
that's great. And it's just interesting to know what we can say to patients to say, if you ring NHS 111, if you're in a situation where it's obviously not life-threatening, 111 or a walk-in centre is probably the better way to go to help the whole system function, and it will get you through to the right person in the right way. So it's really, I try as best I can to encourage people to use the 111 service, which they may not like, but it gives them that medical review.
Get through to 111, there are delays in all the systems, so actually you can do it yourself. You can do just type in go 111 online and you can answer the questions yourself. 111 online. A lot of people are not aware of it. You just go on. There you go. You start.
There you go, and they can just go through the symptoms, and that gives them the stuff that is actually a 999 call straight off.
And then just check that. You want to check my symptoms. Next.
And you just go through.
Just go through it. So
try
to see online as well as
the call. Great. I picked up on your point about taking the medication to hospital. Absolutely. Just remember, it does need to be labelled with the patient name, anyone that's taken their meds to hospital. So it's sometimes useful to have yourself a little emergency kit, as it were, if you're a patient who is adrenal insufficient and you have had one crisis and you know what it's like and you're worried about having another and you think, oh, don't want A&E again, then maybe just have a small package where you can keep your steroid card or a spare steroid card or the sick day rules, your endocrine consultant and endocrine nurse contact details all together, and have it maybe near the door or somewhere that you can just grab. And in that, keep your medication list from your GP, but also a supply of your labelled medications. Got to have your name on, and they've got to have the actual prescription that the pharmacist puts on the box at the front. Hopefully, you'd be able to remember to pick that up as you went out the door.
The ambulance crews, as I said, it's pretty standard to ask patients to gather up the medicines and take them to hospital for any patient.
So if they had a little pack like that, that would be ideal, wouldn't it? It'd just be, it's over there and they could take it with them as they went.
Yes.
Yeah, excellent. And then going into A&E by car, absolutely. If you've had your emergency injection at home, if you're able to give it yourself or family members been able to give it for you, that will get you some time of stability to get to A&E, to get that review, to get whatever has caused that crisis stabilised.
Yeah.
So yes, rather than maybe waiting several hours, in some cases we hear on the news, for an ambulance to arrive to you, if you can get to hospital in car, you're not driving, somebody else is driving, absolutely do that.
Yeah, and Pauline, yeah, we advise sometimes people to get, maybe be able to get a taxi. But
Yeah.
a lot of people think that if you get in an ambulance, that you're seen quicker, and that is not the case. When you arrive at A&E, you're seen in order of priority of anyone that arrives, whether they're arriving by car or ambulance. You'd be surprised how many people think that the ambulance gets you seen quicker. It doesn't.
Well, it doesn't, does it? Because there's so many people waiting in ambulances outside of A&E now.
Yeah.
And it's that triage system at the A&E door that looks at you clinically, what's going on, what your need is at that point in time, that gets you into the medics, nurse consultants, whatever, in A&E.
Yeah.
And yeah, just I would emphasize again, shout from the rooftops, steroid dependency.
Yes.
Anyone in uniform that you see, as often as you can, wave your emergency bracelet at them, steroid cards like confetti, just let people know, because not every healthcare professional is aware of adrenal insufficiency. They all have their own specialty. So you, the patient, has to be your own expert in that way, and or your family member for you. Make it known. Get your consultant on the phone, or get your specialist nurse on the phone. They can then put the things in place when you are in A&E to get you where you need to be. I think that's it for me.
Oh, that was so useful. Seriously, thank you both so much for your time. I mean, as a non-pituitary patient, I was completely engrossed making notes. So, yeah, thank you.
Yeah, that will be a fabulous resource to have on the website.
Thank you for tuning in, and thank you so much to Cathryn and Pauline for joining us and for bringing all of your expertise and all of the information. It's been so useful today. And thank you to everyone who's taken the time to tune in. All of our sessions will be available to watch on YouTube and on our website at a later date, or probably straight after this. So please feel free to head over to our social media channels and to our website to see the other sessions available, as well as some more resources. Go to www.pituitary.org.uk. We are really proud to be able to bring you a whole month's worth of different informative workshops and online sessions for free, but we rely heavily on the kind donations of supporters. If you found this session useful and are able to do so, please consider donating to the Pituitary Foundation by texting LivingWell10 to 785 to donate £10. Text costs £10 plus one standard network rate. And don't forget to check out the rest of our Awareness Month programme on our website and get your tickets from buytickets.at/the Pituitary Foundation. So thank you, and we hope to see you at another session again soon. And thank you again to Pauline and Cathryn.